for our MAESTRIA webinar. We appreciate you taking the time out of your very busy days. So my name is Kate and I'm the product manager for microbiology, blood cultures and automated AST. And I'm joined by my colleague Jamie, who's the product manager for IT and data.
Good afternoon.
So just, thanks Jamie. So just in terms of an agenda, I'll do a little bit of background in terms of guidelines for blood culture pathway, and then Jamie's going to do the heavy lifting and go through MAESTRIA and CLARION Lab Analytics in more detail, and then demo the middleware. So we also have Lauren, our colleague with us today, who's going to keep an eye on the Q&A. So as we go through the presentation and the demo, if you do have any questions or have any comments, please do put it into the Q&A function. We'll keep an eye on it, and there will be time for some discussion at the end of the presentation. So when we think about IT and data in terms of laboratory and microbiology workflow, it can be a little bit overwhelming, and it can be part of that dreaded conversation. It might strike fear into some, but for others, people are quite familiar with using data and using it well, such as surveillance scientists would be used to extracting and manipulating data for isolate numbers, for tracking resistance, investigating any healthcare associated infections and so on. And then from a quality perspective, laboratory scientists would be used to looking at turnaround times from receipt to result. So I think something that we might all be able to agree on is that this is usually a difficult process with this data seemingly locked away in LIS systems. And these systems that simply weren't prepared for the evolution and the amount of information that diagnostics in general, and in particular microbiology, would generate as more and more technologies came on board. So when we were considering the launch of MAESTRIA and CLARION Lab Analytics and what we wanted to demo here today, we wanted to be sure to include items that were relevant and useful. So the need for information around antimicrobial stewardship and knowing how your own patient cohort, antibiograms and resistance levels can impact clinically is pretty straightforward. But the auditing around blood cultures is developing and changing currently. So I just wanted to go into a little bit of this background at first and where we're coming from our perspective. So again, as I go through it, feel free to put any questions or comments into the Q&A box. So where we're coming from in terms of the blood culture pathway, most of you might be familiar, but in June of last year, NHS England published their executive summary following their findings of a UK-wide survey of blood culture practices. And in this summary, they set out proposals to improve and standardize the pre-analytical phase of the blood culture pathway. And they strongly emphasize the links with improved antimicrobial resistance diagnostics and its impact on sepsis patients. And so they concluded then with a set of recommendations for best practice. The four main recommendations of this were to build on the existing national guidance and best practice. So that was SMIB 37, which was active at the time. Implement local monitoring to identify areas for improvement. AMS and AMR to be a core part of clinical leadership, and trust governance, again emphasizing that link to sepsis and the blood culture pathway. And they also set out to improve regulation and accreditation, where they were engaging with UCAS to see how this would look and what the impact and the requirements on a laboratory would be. So we're just going to look a little more in detail of the implementation of local monitoring to identify the areas of improvement, because this survey highlighted two areas in particular. So the first focus was on the collection to load time, so the time from drawing the blood from the patient to actually getting those bottles physically onto an instrument, which is critical a part of the pathway, but it does involve a lot of multiple personnel outside of the laboratory setting. So some people who've joined us today may be aware of the campaign that's already begun around some hospitals and trusts, where everyone involved in this pathway, from clinicians to nursing staff, support staff, are encouraged to try and reduce that time and get blood culture bottles onto the instrument within 4 hours. The second main part that they highlighted was the volume of blood, which again is critical in providing an accurate result. And the more blood that you can draw from a patient, the more likely you are to identify a causative organism in a bloodstream infection. So NHS England have made a tool available to try and capture this data and make this easy for laboratories. And just to give you a little look at it there, it is in the form of an Excel sheet. So data will have to be recorded manually. But again, this is just the first step in this process. Since then, the new SMI for the investigation of sepsis has been published. So when reviewing this SMI, I noted that, again, the blood volume has been a particular point of focus. So it's not just about having the correct volume of blood in each bottle, it's also about the number of sets. So 2 sets of blood cultures are recommended. And regarding the antimicrobial stewardship side of things, it is going back to that start smart and then focus. So I'm sure we're all aware that, sepsis patients with bacterial infections with any resistant organisms or MDROs are the most difficult to treat and are at higher risk of hospital mortality. But we also want to balance that and limit the overuse of broad spectrum antibiotics, which will prevent resistance from developing, hopefully, and also to preserve antibiotic efficacy into the future. So in this SMI, there was a number of auditable outcome measures that were recommended. We focused here just on 3 because we think that they can reflect directly into the laboratory setting. So the first one is the audit of the total turnaround time from specimen collection to clinical action. And this has further been broken down into a number of sections. So the time from collection to receipt within the laboratory, then from receipt to loading onto the blood culture analyzer, which is obviously within a laboratory's control, whereas the first step isn't. Time from loading to registering positive. This, of course, is outside of the control of anyone and is strictly down to the organism growing in the bottles. And then the time from flagging positive to results being available in terms of identification and susceptibility. And then beyond that, the time that those results are available to being reported and acted upon. So the second one there is the audit of the impact of blood culture results on antimicrobial prescribing. Again, this is more on the clinical side, but where we think it will impact the laboratory is having to make that information available of when results were available for actioning. And thirdly, then the audit of the blood culture volume collected in adult patients only. So it was this blood culture volume where we thought we could really help laboratories in terms of collecting that information. So without going into too much detail, anyone who's familiar with the BacT-Alert Virtuo will be aware that this is an automated system, and it can actually automate the measurement of measuring the blood culture blood bottle fill volumes. So it'll collect the fill volumes for all adult bottles and is done initially when the bottle is loaded onto the instrument. You can set alerts then so that at the time of loading, you can be alerted to whether it's overfilled or underfilled, if that's something that you want to act on and contact a clinician. And because it's also taking measurements of individual bottles, it will not give you an average volume over time, because obviously if you have an overfilled bottle and then an overfilled bottle, when you add them together, it might look like everything is okay. So to tell you more about what can be done with the data, then I'll just hand over to Jamie.
So then, afternoon, everyone. So what can we do with that data? So the focus of my demonstration is going to be around MAESTRIA and CLARION Lab Analytics, which is our current data and IT offering for the micro lab. I'm hoping everybody can see and hear me okay at the moment. Is that all right? Okay, and then moving on to the next slide. So what we've got within, excellent, thank you very much for putting the thumb. So what we've got with MAESTRIA is we've got the data coming in from 2 locations. So as we mentioned, we've got data coming from instruments such as the Virtuo, but we can also take in data from competitors' instruments. So you can see an Adagio there in the top left-hand corner. You can also see some manual methods there. I think that's an e-test strip there. We've got data coming in from there, but also from the LIS, of course. Incredibly important that we get a rich data source with as much information as we possibly can around specimen collection time, date, location, all of that stuff. So they've got that coming into our middleware in the middle, MAESTRIA. That's consolidated in a single location, and that's where we can transform sorry, Kate, and that can be transformed then into actionable insights into CLARION Lab Analytics. If we can move on there now. If I turn off my camera, maybe if we have bandwidth issues here. So we've got MAESTRIA is a brand new middleware for microbiology, a true middleware. And it's the improvements that on previous versions of our middleware can be broken down into three main areas. So we've got workflow optimization. So there's a redefined positioning to cover the customer's own microbiology workflow. So that's not just our instruments, but of course competitors' instruments. So we've got one tool for all of the microbiology activities. We've got microbiology results expertise because we've got integration to more instruments and methods. We've got consolidated microbiology results, bringing customized expertise on all lab methods. And this should bring better patient care. So it's effectively an extra pair of expert hands in the lab. And then finally, what we'll be concentrating on predominantly is the microbiology into data into insights. So this is possible because we've got a built-in statistical reporting module, but also the advanced data visualization tool, which is CLARION Lab Analytics. These are dedicated data management tools, which give laboratory workflow follow-up and surveillance activity. So the bottom line here is you don't need to be an IT expert to use data within your lab and bring actionable insights. If you could move on to the next slide, please. Yes. Thank you. Excellent. So this is MAESTRIA and Lab Analytics, our data management solutions. So we've got four main areas that it covers. We've got blood cultures, which we'll look at in much more detail, which will give us an overview of positive blood cultures, but more particularly an insight into the efficiency of the blood culture workflow, which is mean load time, time to result, instrument capacity, contaminant trends, blood bottle volume, all that good stuff. We've also got, we also cover ID and AST to look at organisms found in the lab and their susceptibility profiles. We've got a section on lab performance, lab efficiency, which will give us detail on particularly on time to result, which we really want to look at, and the turnaround time. But also we've got an AMS module, so we can look at cumulative antibiograms, which obviously is a big driver of the our improvement in empirical antibiotherapy. So I'll move now onto the demo itself, if you don't mind. So I'll just share my screen. So if you bear with me, here we go. Can everybody see that now?
Yeah, that's
Excellent.
up, Jamie.
Brilliant. Thank you very much. So this is the main home screen for MAESTRIA. And I'll just leave my camera off for now if you don't mind. So this is the main point for navigation. So I won't go into this in too much detail because our time is a little bit short, but you can see on the bottom we have our connected instruments. So this is just a demo system. So these are dummy instruments, but we've got the Vitek MS, we've got a Vitek 2, and in this particular instance, an Adagio and an EpiSeq. Along the top here, we've got our widgets to navigate to different areas. So we've got an order entry module, which is predominantly for systems without an LAS, which we won't be concerned with today. But the areas I want to really look at are the lab workflow, the manual entry module, lab analytics, CLARION Lab Analytics, and we've got a supervision model here, which just gives us a little insight into things like our connected instruments, for instance, the health of those, and also our communications interface. But I'll just close that one for now. The first thing I want to show you is the manual entry module. So this is something that was mentioned in terms of the significant expansion of the number of manual methods we can use within MAESTRIA and we can add. But we've also got, which is pretty exciting, is a new gram staining module. So I'll just very quickly show you how that's used and how easy it is. So we'll just pop in this case, a dummy specimen ID here. And you can see here we've got the ability to enter our various gram stain observations. Now, I'm sure this is absolute nonsense. I'm certainly not a microbiologist. I'm just an IT geek. But you can see how easy it is to enter those observations and any additional observations on this side. And then all I would do would be to save this. And then that would go automatically into MAESTRIA. I'll show you how that happens a little bit later. And then back to the LIS as well. So the point about this, I think it's worth making, is that MAESTRIA is accessible via a browser, so it's from anywhere within the laboratory or even the hospital, indeed, and it's also totally touchscreen compatible as well. The whole thing around MAESTRIA is that it's designed around ease of use and around just the ease of use of the graphical user interface and around touchscreen compatibility. So if you can imagine you're sitting at the gram bench, you could be accessing MAESTRIA and the gram staining module via a tablet or an iPad. It's touchscreen, so you've got the tablet there. You enter your observation and then save, and then it's automatically back into MAESTRIA and then back out to the LIS. So I'm just going to show you another bit on here. So if I come out of that and I go back into the manual entry, I'll show you just very quickly also how easy it is to enter manual entry results for ID and AST. So you can see on the left-hand side here, we've got all of the different methods that we can use for entering manual methods for IDs. And then on the right-hand side here, we've got all of the different methods, ATEST, ATB, RapidDec, Kirby-Bauer, that we can enter AST results. Now, the important point about this, of course, is that once we've got these results entered for all these different methods, we've then got them consolidated into a single location within MAESTRIA. And what that means is that we can then manage all of our AST expert rule filtering in a single location for all methods, and all of our breakpoints as well, all within a single location. So the next thing I'd like to show you is the lab workflow. Now, this is basically the go-to for all of our lab work, for our main activity dashboard. Now, there's probably a few things that might be familiar to one or two of you who are familiar with MAESTRIA. So we have, for instance, the positive bottles pins. So that's they're extremely visible, so that you know that they're for review. And some of these lists, these activity lists, these buckets, you would want to, some of these lists are kind of no-brainers. You would want certain activities to pinned for review, but these are actually configured individually around each individual laboratory. So if I show you, for instance, well, a good example of this is that we have this particular bucket, this particular bin in some sort of East Asian language. So this is one of probably my colleagues in another part of the world has configured this, because we all have access. But they've been able to configure this, rename this particular list, and change the color as well. So you can have as many or as few lists as you like in here. But just show you how some of these are configured. If I go into the demo specimen one, for instance, you'll see that all of these particular specimens appear here because they have demo tags against them. So if I just pop into this particular one, excuse me, I'll pop out of there, pop back, I'll go into this particular one here. So you can see that this specimen has two tags. It's got a demo tag, which means that it's part of this particular list, and it's got a call physician tag also. So the demo tag is just useful for my purposes, but really these probably take the place of the sort of post-it notes that are left around the laboratory. So speaking to some customers when I was demonstrating this a couple of weeks back in Dublin at Biomedica, they said that one potential use for this might be for handover from one shift to another, where there are various outstanding tasks that always need to be looked at first. Instead of having post-it notes or notes around the laboratory, you could create a tag, because these are fully configurable for handover. And then you might have 10 or 15 tasks that need to be looked at first. As soon as it's done, you take the tag off and then it drops out of the list. I'll just pop that one back in for our purposes. Likewise, we've got a call physician tag on this one. So that one means that might drop into a list for instance, need help. So we've got these need help ones that have the call physician against them. I think we're only scratching the surface yet of what we can actually achieve with all of these. But the point is that all of these lists are configurable around the individual needs of the laboratory. It's not around what some R&D guy at bioMérieux decided you might need 3 years ago when development started. It's about what you need now, and more particularly what you might need tomorrow. I'll just show you what we can do further to that in support of some of the blood culture modeling that Kate outlined for us. If I look at the bottles in progress here, what you can see here is that we've got all of these different tags on the top, which are what have been used to configure that particular list. So if I drop all of those out, for instance, you can see how the list is expanded. So even that list is fully configurable. But if we think back to, for instance, the audit tool provided by NHS England and the things that were required on there as part of that Excel spreadsheet, we know that they needed blood bottle volume, for instance, but what they were also looking at is number of sets and the load time on there. So what we can do is very easily is if I just show you in here, I can filter on date ranges and specimen types, lab ID, patient name within here, just for that particular list. But what I can do is reconfigure it. So if I go into the columns here, what you can see here is these are the parameters that are there already. Now for that particular list, I know that I don't need the time on the test, for instance. That's not required for this. I don't need the projected end time for that. I don't need the incubation system or the cell, but there are other things that I do need. So if I go into here, I can add various parameters. So I know that I've got the bottle load time. What I also need is the specimen collection time. Let's have a look. So there we've got the collection time and date. What else do I need in there? Well, I know that they also need some information around the specimen location. So I should be able to find the specimen institution, the specimen. So here's the specimen service. So that's also the location within the hospital that the specimen was collected. What I can also do, I hope you can see the list automatically readjusting in the background there. I might want to, for instance, rearrange this list so that more closely mirrors the NHS England list. So I might want to move, for instance, the collection time in front of the bottle load time. The specimen service might want to go up to this location here. And you can see that I'm configuring a list in real time. And all I would need to do then, I can't save these lists, unfortunately, because I don't have configuration rights. But what I would do then is I could save this list. Well, first of all, I could export this list as well, just straight out to Excel to mirror exactly what NHS England need. But then when I go back into here, I could save that list so that instead of having a list called blood cultures, I could have one called NHS England blood culture audit. And it's there ready to go with all of the information I need and ready to be exported at any time. And if NHS England, excuse me, modify that list, then we can very easily amend it in order to provide exactly the information that's required. One other thing I'd like to just quickly show you within MAESTRIA for this is that we've got some of those blood culture KPIs being monitored in real time. Because this is a demo system, nothing's been loaded during this time period, but if I go back to the last 180 days, you can see that the time to load, it's been continually monitored. The time to detection that we need for our turnaround time has been continually monitored, and the time to unload has been monitored. Now, again, this data isn't great because it's just dummy data, but you can see that we're tracking that in real time. So you've got a very easy way to check that. What I'll also say is that we have a statistical reporting module built into MAESTRIA, as we did with Myla, and we're working with Global now on configuring a report within statistical reporting, which is just based purely around the needs, the auditing requirements for NHS England. So hopefully in the next release of MAESTRIA, we'll have a report also which is ready to go and can be built and automated within statistical reporting module. So I'd just like to move on now and staying with the blood culture auditing aspects, I'd like to go into CLARION Lab Analytics. So CLARION Lab Analytics is, again, going back to the idea that you don't have to be an IT expert to realize the full potential of these tools. This is absolutely based around, the ease of use. It's a really dynamic tool. It's not built for IT experts. It's built for anybody to use. Literally with CLARION Lab Analytics, if you want to find the data, just click on it and it'll go there. I'll show you just in a second. So this is the main navigation dashboard. But the first thing I want to show you is the Lab Manager dashboard. This is, I think, really lovely because it pins all of the KPIs for the laboratory. This is an expanded module. It has, instead of having 6 KPIs, it now has 9 with CLARION Lab Analytics and MAESTRIA. And as you can see straight away there, it covers some of those key performance indicators that we were looking at for NHS England, some of those SMIs. So we've got the blood bottle volume being tracked here. We've got contamination rate, but of course we've also got mean load time here. A little bit further down, you'll also see that because we've now got the ability to enter those gram results, we've also got a gram staining module. So it's monitoring the time elapsed from positive blood culture to gram result entry. What you'll see here is that we've got tracked the last 30 days versus the 30 days of before, and we've got this lovely trending arrow as well. So we can see what the direction of travel is, whether it's going in the right direction or the wrong direction. So mean load time in this case is fantastic. It's trending downwards from over the 30 days before. I can also drill down, just expand this data out a little bit. And I think this is a good example of what I say when I say that it's a good data visualization tool. The average was, as you see, it's tracking it around 3 hours, just over 3 hours. But you can see that we've got these statistical outliers as well. We've got a single instance there where it's 23 hours, and one where there's 12 hours. So we've got outliers that would skew the data. We can exclude those from it as well, so that we don't have individual instances of that are affecting the true picture of what's actually going on. What I'll do now is I'll just show you some of the blood cultures in a little more detail here. So if we go to the blood culture dashboards here, you can see that we've got analysis of all positive bottles here. Bear with me, and you've also got, excuse me one second. I do apologise. That was my dog, who I haven't got a dog sitter for, wanted to leave the room. So we've got what I want to look at in a little more detail is the efficiency tab. But what you can see on the left-hand side is that we can filter in so many ways on here. As soon as you click on it, you get drilled down straight into the data. So we can filter on things like low fill volume, because of course we're tracking every single bottle. We could track on normal fill or high fill bottles. We can take those out. You can see that's getting pinned there. Or we could track on positive fill bottles only, for instance, if we wanted to do that. We can also filter on locations as well, which becomes incredibly powerful when we move on to the next section. So if we go to the efficiency, we can see that the mean load time here is being tracked. If we wanted to expand it out, this is currently defaulting to the last 2 years of data. But if we wanted to change that to 1 year, for instance, click on that and it automatically readjusts in real time. If we're looking just at this mean load time, you can see that what we've got here is we've got at institution B, we've got a fairly significantly higher load time at that location. So if I go into that, we can very easily track particular areas or services within the hospital that might be of particular concern and might be in need of extra help, additional education. We can see that service 5, for instance, has got a significantly higher, what's that, something like 30% higher mean load time than elsewhere in the hospital. I just take those out there. I'm just going to show you one other thing here. This is a nice little tool here. This is it's called the blood culture instrument follow-up, but what it actually is tracking is the percentage of instrument load at any one particular time, and this is color-coded. So this is tracking daily. I think you can probably see 19th, 20th, 21st there, but we can see if we just track a little bit further back where the instrument capacity is getting incredibly full. So it's a fantastic way for us to be able to track percentage of instrument capacity. It's a good way to track seasonal trends. But for instance, if we were to increase the number of sets that we were using per investigation, you would be able to use this tool to track whether you actually have sufficient instrument capacity to do that. I just move on a little further now to the blood bottle volume. We can see again in here how easy it is to track particular training needs. And if I think I'm filtered on locations here, but if I go to phlebotomist, for instance, what you can see here is a really easy visualization of how effective each phlebotomist has been, for instance. So if we go to phlebotomist 1, they've got 40% of normal fill volumes. But there, if we go to phlebotomist 4, for instance, we've got 29.7%. If you took that to an institution, again, you could very easily drill down into any particular institution or location within that might have a particular problem. I think we all suspect that there are areas in our institutions that might have more issues with correct and best practice for blood culture collection. A lot of people tell me that might be ICU, but if that was the case, then let's say that this is ICU in this particular instance, institution B, service 5, then you could easily pin that. And you could look at data for the entire hospital. You can see that it actually stays pinned. So wherever I go now, it's pinned against that particular institution, that particular location. So if you wanted to do surveillance just on ICU, then you could keep it there. If you wanted to bookmark that, for instance, it's incredibly easy to do that. You can see here that I've actually bookmarked A&E, so it's easy for me to go back to. If I've done a complex search or just a search on location, I can go back to that particular location and it'll automatically refine against that. Just want to show you one more thing within here. I want to show the lab performance to move on to how we can measure metrics for turnaround time. So what you can see here is measuring the average time to result. Here at the top, and you can see for the last 30 days, it's 102 and that's tracking down against the selected period of time, which is 1 year. But if I go a little bit further down, you can see that we can actually break that down into the time per process step. This is without blood culture results, but I think it gets more interesting here when we go down into the time per process with blood culture results. So we've got not just the time to load, but we've got the collection time to reception and then the reception to load. So we've got a breakdown of the time to load in terms of how long it's getting to reception and then onto the instrument from there. Then we've got breakdown into the load to result, the gram staining from positive blood culture. We've got the ID section in there so that we have all of the individual steps broken down. But we don't just have that. We've also got the time to result from specimens with blood culture results as well. Sorry, the time to result cumulatively. Okay, so we go from the collection to reception. So we've got 0 hours here, and then it gets to reception in this particular location at 2 hours, and then it takes a further hour to get loaded, and then that's the incubation time to result, and so on, down to 61.56 hours in this particular case. So you can see how easy it is to support that interrogation of the turnaround time, how easy it is to look at the individual steps and really drill down into any particular step and any efficiency savings that you might want to make. I'm conscious that I'm running out of time a little bit, so I'm going to very quickly go back to MAESTRIA because I want to show you a little bit also around ID and AST. Just quickly show you in the lab workflow again that we do have the ability to track blood culture contamination. I won't go into that, but you can see also that we've got the ability to track MDROs within here. So if we go into that particular list that's been configured, you can see that if I go into Robert Jolly, if I went to the MDROs, you can see that he's been flagged as having a potential MRSA there for that one. As soon as we either confirm that or discard it, if we discard it, of course it won't, but if we confirm that, then it'll become available for tracking for the MDROs within our CLARION Lab Analytics. I'll just quickly show you a few other things within here as well, just to give you an idea of what's available within MAESTRIA within this specimen view. If I go to the bottles, you can see we've got the total collected for the 2 supported bottles. So we've got 20 mils over 2 bottles in this particular instance, perfect 10 for these ones. You can see that we can have a look at the growth curves within here. You can have a look at the bottle image as well, which is very useful for us because we take images of the bottles to track the volume. You'll also see in here that we've got the staining observation if we took one, if that's been entered, and then the ID and AST here. You can see an example of how all of the methods of identification are consolidated into a single location. So we've got our isolates have been ID'd on the Vitek MS, but looking across to the AST results, we've got E-test here, we've got Kirby Bar, and we've got Vitek 2. So the cumulative antibiogram, the AST result here, is going to be for all of those methods that have been employed in this particular instance. Just going to show quickly how that might translate then into lab analytics. If I go to I need to unpin these, of course. So if I go to ID and AST, you can see that what we're doing within here is this is a really powerful driver of our AMR AMS strategy. If I go to susceptibility trend, for instance, if I wanted to have a look at trends against, if I wanted to do surveillance on VREs, for instance, if I just very quickly go to here, I'm going to, whoops, not typing anything. Oh dear. This is where it all falls apart. With me, so I'll pull it into Enterococcus faecalis, and then of course I'll do vancomycin in there. Brilliant. I'll filter on that. Great. So you'll see that automatically readjusting in real time in the background. If I just expand this out, what you should be able to see then is a very clear trend from 96.3% on one end, going down to 90% on this end. So again, a very powerful data visualization tool. And I should also say as well, there's many ways that we can actually share this data. So you could also, of course, bookmark this particular search as I showed you. But if I just go into here, I can show you that we can share that by traditional methods. I'll show you in a second, but we can also embed this URL. So what I've got here is a URL that I can just copy. If I do that, I can just drop that into Teams or an email, and then whoever logs in on the other end, when they click on that link, they'll see exactly what I'm seeing on the screen. So it's an incredibly immediate way of sharing data. What I can also do as well, if I can download it, of course, as just as a PNG, or also as the PDF, or just the raw data for that as well. We can track MDROs also very quickly. I'll show you this. And I'm filtering on antibiotics here, of course, so I'll take that out. But you can see our top 15 phenotypes here. So if you wanted, for instance, just to filter on MRSAs, you would just click on that. It filters automatically for that. And I'll show you one last thing, because I know that we need to move on to the Q&As. If I show you the cumulative antibody diagram, again, just the basic stuff that surveillance scientists will be trying to track all it, you know, but perhaps finding it difficult to access the information. If you wanted to do surveillance for the last year on staff, for the you know, on Staph aureus for the last year, you could get against a certain location. You know, we're talking seconds in order to get to the information you want, and then you bookmark it. And then you can go back to this time and time again. An incredibly easy way to access and interrogate information, and I hope act in the in support of the blood culture KPIs and the sepsis pathway more generally. Now, I'm going to have to leave it there because I've run out of time. I think I'm just scratching the surface. You can probably tell I like to talk about this stuff, and I could go into much more detail. We'll talk about this later, but please, if you want to discuss this further with me, just get booked up via the survey for a demonstration, and I'll come into you to discuss further. So thank you.
So, thank you very much, Jamie. As Jamie said, we're just kind of scratching the surface, and Jamie does love to demo these tools and to talk about them. So he would be more than happy to talk about them in more detail. But for the moment, does anyone have any questions? Feel free to either raise your hand. We can take you off mute, or put it into the chat, or into the Q&A, sorry, into the Q&A function. But while people are taking the opportunity to do that, I'll just ask Jamie one that we usually get asked, and it did come up in one of the registrations, and that's in terms of the contamination. I know you looked at it there very briefly, Jamie. And just in terms of tracking the contamination, then is that something that the user can kind of define to make sure that you know, what they're saying is contamination is contamination? Sorry, Jamie, you're on mute there.
So I'm just saying I'll come off camera just to save bandwidth again, just in case, because I suspect I'm having a few issues. What it does is it uses an algorithm. So in order to determine a percentage likelihood of contamination. Now, it's the FASs are probably better to qualify to talk about that than me, but we have a list of suspected contaminants as part of a database that the customers can add to or take away from, so they can define their own contaminants. But after that point, it's based on, I believe, the suspected contaminant. If you have like different IDs against a pair of bottles, for instance, that would flag it, but also the time to detection, I believe, as well. So the shorter time to detection would flag a potential as well. And of course, you don't have to confirm it; you can discard it as well, or you can just click on that specimen and run a further investigation. But something which is, if it's tracked on a daily basis, it shouldn't be arduous. And very quickly, you start to build up a really powerful body of evidence about contamination, and more particularly, kind of location of contamination potentially within hospital, and potentially areas where there might be a need for further education and attention.
That's great, thank you. And just going back then to the blood culture volumes. So you demonstrated there, and you showed us just the individual that was for a patient, was it? And can you pull a number of those together, just if somebody wanted to do quite a large audit?
What we have within the statistical reporting module is the ability to have a look at or the blood culture workflow, which will have all bottle data. And also within the statistical reporting module, which I didn't show you just because of time constraints, you've got the ability, it has in there, unlike lab analytics, it has all of the patient demographics and all of the bottle data within there. So within statistical reporting, you can pull all bottle and patient data as a consolidated report.
Perfect. And we just have a question there in the Q&A. So what's the role of UCAST and CLSI icon marked in Lab Analytical Portal? Is it for duplication only? So I'm not sure what that is because I can't see the demos.
I'm not an expert on breakpoints, and this is an incredibly complex area. And as I'm sure lots of you know, if we had very specific questions about that, I would have to direct that to the application specialist team. But what I'll say is that it's not for duplication. You can manage all of your breakpoints methods for all manual methods within MAESTRIA.
So does that mean, Jamie, just in terms of that management, so if you were to put in any additional e-tests or anything manually, does that mean that that Mila will do that interpretation? Is that what that means?
It does.
Based on
exactly
the breakpoints?
Yes, thank you.
Perfect. Does anyone else have any further questions? I can't see any more, but do scream at me if I don't. Just so before we wrap this up, I want to say thanks again to everyone for joining. Hopefully we've answered all your questions and given you just a taster of what can be done with MAESTRIA and with CLARION Lab Analytics. So do get in touch. Jamie's email address there is on the screen. Also, the QR code there that you'll see in the center will bring you straight to a survey page that you can give us feedback, and we'll send the link out to all of our participants as well. But just to put everyone on everyone's radar, we have 2 sepsis summits happening this year. So for our Irish customers, or for anyone who'd like to take a tour, we have ours in Athlone in the Hudson Bay Hotel on the 21st of June. And then for our UK customers, or again, anyone who wants to take a tour in the other direction, on the 5th and 6th of September in the University of Nottingham, if I'm not mistaken. So we will be sending out further information and agendas and inviting customers and to register in the coming weeks. But again, if you want any more information on this, get in touch and hopefully we will see you there. And with that, I think we'll bring the session to a close. And thanks again, everyone, for joining.
Thank you, everybody.
Take care, everyone. Oh, I see one raised hand. Oh, it's gone.
Have we got a raised hand?
No, I think I think that might have been an error.
Needed the toilet.